Picture this, you are lying in a hospital bed surrounded by copious amounts of healthcare professionals, all of whom are talking over you and not to you. How would you feel to simply be referred as the Hip and Bay 3? Despite being the expert of your problem, you are giving no opportunity to add input to your care plan. You are probably thinking this sounds ludicrous. However, unfortunately, this is often standard practice. But it shouldn't be. Before we begin, I would like to take the opportunity to welcome you to today's TED Ed Talk. This presentation will be exploring person-centered care process, which focuses on direct patient care activities. So, you may be wondering, what exactly is person-centered care? Whilst there are many varied interpretations of person-centered care, the World Health Organization defines the term as an approach to nursing care that endeavors to place utmost importance in the individual's values, beliefs, and life experiences, and responds to their needs in a humane and holistic manner. Person-centered care represents a major shift from the previous disease-orientated, hierarchical-driven approach towards one where patients' free will, desires, and experiences are integrated into the entirety of the healthcare process. When considering person-centered care, services involved need to be flexible and tailor themselves to the situation. For example, in a hospital setting, the doctors, nurses, family members, and allied teams such as nutritionists and physiotherapists will conduct a team meeting. In these meetings, matters concerning the person in question will be discussed and many thoughts will be considered, ultimately aiming for the best outcome for the patient. However, it is important to realize that delivering person-centered care does not simply mean providing patients with whatever they desire, whenever they desire it. Rather, it is about considering the unique circumstances, values, beliefs, and perspectives of the individual and collaborating with them to make the experience a more satisfying one. To understand this further, let's examine the hypothetical case of Betty. Betty is an elderly woman who wishes to spend her dying months in the comfort of her home alongside her beloved dog, Sammy. The care that Betty was receiving in hospital could not be replicated at home, and this was placing strain on her loved ones. In situations like this, special circumstances for Betty should be considered by the nurses who have the power to make her dying wishes come true. Having a family pet brought into the private hospital room until last goodbyes were said is a small price to pay so that Betty's last few days in hospital were as homely as possible. Now that we have an understanding of person-centered care, let's delve deeper into the key contributors to person-centered nursing. Firstly, let's examine shared decision-making. Shared decision-making is a person-centered process in which the patient and healthcare provider work together on decisions concerning the patient's healthcare. This collaborative approach allows each party to share their perspective and provide necessary information in order to reach a decision about the patient's care options, treatments, and overall healthcare process. Shared decision-making acknowledges the patient's preferences, beliefs, values, and circumstances. Additionally, this allows the patient to be provided with the necessary information to make informed decisions regarding healthcare decisions which affect them. Consequently, this approach to nursing establishes a mutual trust between the patient and their healthcare provider and empowers the patient to play an active role in their healthcare. Sympathetic presence is an acknowledgement and understanding of another person's particular experience, as well as engaging with the patient in the now. This integral part of person-centered care plays a facilitative role in the relationship that a healthcare professional has with their patients. By having that presence, it allows clinicians to navigate the problems of their patients as well as gaining rapport and trust. A supportive care environment allows for person-centered care to be achieved. Person-centered care acknowledges the importance of the patient's beliefs and values that must be identified in order to accomplish an optimum outcome. The mindfulness of the practitioner towards the beliefs and values of the patient is important in the process of identifying potential conflict that can impact the care of the patient. Furthermore, the importance of mindfulness of the healthcare practitioner will help sustain a trust and open communication with the patient. As the beliefs of the patient are important towards their care, working effectively with patients' beliefs and values can be accomplished by understanding as well as getting to know each and every patient and their beliefs towards the care they are receiving. The health practitioner should remember their professional duty of care and must be able to differentiate between their own personal values and the patient's beliefs as well as their preferences. This is a skill that health professionals should possess as well as build upon through reflection as well as strategy, and lastly, team collaboration. The engagement of patients in person-centered care involves involves health professionals including and enabling patients to contribute with their healthcare decisions. Patients' autonomy as well as independence will be promoted through the active engagement between the nurse and the patient, where the patient is given the opportunity to make a decision with the given informed choices of different available options. This is done through providing patients with information that is focused on them. Furthermore, it is important that the patient understands the complexity of the information to enable them to be open-minded about the consequences of each option. Holistic care is focused around the whole patient, taking into consideration their spiritual, social, and emotional needs rather than just the physical. It is important to understand that holistic nursing is a practice that ensures the patient meets their own self-care needs along with maintaining any medical attention they need. Through the practice of this comprehensive care, the patient is therefore treated as a person rather than an illness. The person-centered care process provides the patient with an overall satisfaction and a sense of well-being. By involving the person's values, beliefs, and decisions, it allows the patient to engage with their treatment and ensures a therapeutic environment is created. The focus of the person-centered care process is to achieve a successful outcome for the patient with the implementation of holistic care, a sympathetic presence, engagement, shared decision-making, and working with the patient's values and beliefs. This tool is used to enable nurses to identify primary elements in their approach to care while also ensuring the process is a foundation for future development and used as a goal for ideal person-centered care practices. As a result, the patient is the focus of attention and each decision is made with respect for the person and their well-being. Now, you may be thinking that these components can easily be implemented. However, when it comes to implementing these factors into the real world of practice, several leadership challenges arise. Before we begin exploring these, it is important that we understand the true meaning of leadership, that being a process of social influence which aims to maximize the efforts of all team members towards the predetermined organizational goals. Leadership plays a key role in developing nurses' understanding of the patient's needs and values and the acceptance of the new innovations to obtain successful change in a positive care culture. The first challenge that arises is the pressure placed on nursing departments to meet key performance indicators as a result of legislative policies. For example, currently Australia has the National Emergency Access Target implemented. This aims for patients to be treated within 4 hours of arriving at the emergency department. As a result of this, the healthcare interaction is often rushed to ensure quick patient turnover. This can also be attributed to the lack of resources. Thus, these time constrictions make it difficult for nurses to spend an adequate time building the therapeutic relationships and ultimately ensuring patient-centered care processes are implemented. Documentation is another aspect of which all healthcare professionals rely on. The time frame of 4 hours in which a nurse is supposed to build a report on their patient is majorly spent reflecting and recounting events which happen within the shift. The question is, how can we as healthcare professionals do both at the same time? Department managers have a key performance indicators in which they have to meet to ensure the structure of care is met. Another leadership challenge in which nurses face in the workplace is the hierarchy of power and the lack of continuity. This often results in loss of communication from the nurse to nurse. There is a concept in which it is believed that the opinions and suggestions of nurses offer in regards to a patient care are invalid because they are not medically trained. This is an ongoing issue in which nurses face on a day-to-day basis. The nurses need support from a managerial level and education needs to be provided to all staff to manage a patient's care. Nursing is a team effort and involves a variety of professions. Without the communication and skills of each profession, the person-centered care theory is inadequately portrayed. Finally, the values and attitudes of senior nurses may present a barrier to implementing person-centered care processes at the bedside. According to Boyle and Houston, senior nurses often resist to implementing new challenges as they are accustomed and happy with the way the traditional processes operate. In 2006, a team of nurses introduced a new model of home care to the Netherlands called Boostetoog, which is Dutch for neighborhood care. Boostetoog is a nurse-led and run organization of self-managed teams that provide home care to patients in their neighborhood. The model was designed to improve patient outcome while reducing costs and increasing nurse and patient satisfaction. This nonprofit organization began with one self-directed community of nurses and has grown to approximately 6,000 nurses in 500 Boostetoog teams throughout the Netherlands. What started as a small initiative has grown into a new national standard of care, and due to its success, government health policies have changed. Until the 1980s, Dutch community nurses have had considerable independence in working closely with their patients and their families. However, because of this push to reduce costs, the new system emphasizes paperwork and highly regulates care rather than just spending time with the patients. The growing dissatisfaction among home care nurses represents an opportunity to introduce new ways to provide care. One of BuzzTalk's leading members, Jos de Blok, had a long envisioned a new care model in which nurses would provide community care in self-directed teams with new technology and minimal administration oversight. We choose an organization model which focuses on meaningful relationships and no hierarchy. One of the leading goals of the Buzz Talk continues to be to foster a more humane, efficient, and effective way for nurses to work together. In this perspective, the client is recognized as a whole person and their social, spiritual, and emotional needs are considered as important as the medical needs. In maintaining the success of the program, team members meet weekly to discuss issues such as the current interventions, the use of community resources, and the skills and knowledge needed to fulfill each of their roles. BuzzTalk has demonstrated that a nurse-led transition to an effective, efficient, and humane outcomes-based home care system is possible with an average patient satisfaction score of 9.1 on a 10-point scale. Due to the success, the model is being replicated worldwide, with teams starting in Minnesota, Sweden, Japan, and other countries. A staggering 17,000 people under the age of 35 have dementia. Therefore, the need to redesign hospital wards to make them calmer environments is critical in effective patient care. This is exactly what nurses at the Somerset NHS Foundation Trust in England did. In 2011, nurses with the hospital transformed a 25-bed acute older people's ward into a safe and friendly environment for people with dementia. The nurses' station at the center of the ward was removed to create a social area which included yellow chairs for the ease of recognition to give patients a focal point where they can listen to music, chat, meet staff members, or eat their meals. Changes were also made to the bathrooms where the use of bright colors were incorporated. Sue Wood, the Trust dementia nurse, discussed the positive effects of the changes made to the hospital. It looks like a nice, homely place to be, somewhere where people would feel comfortable. These changes have proven to be successful in bringing out patient safety and care. Since introducing these changes in October last year, the ward has seen a reduction in falls and incidences of violence among patients. Between February and September of 2011, there were 20 reported incidences, and between October and the end of May this year, there were just 7. In conclusion, person-centered care is defined by giving the best outcome to the patient by including allied health staff, family members, and other important organizations. It concerns everyone working together as a team, being open-minded, and not discriminating against opinions and ideas.